Mexico is a large rural state with a limited availability of medical professionals, which often results in lack of access to health care. This is especially true of chronic conditions that require constant monitoring and treatment. In our state, the leading causes of death are heart disease, cancer, substance abuse, pulmonary disease, and diabetes. It's likely that at some point you will wrestle with one of these conditions for yourself or a family member. When you do, let's hope that your general practitioner is knowledgeable on these and other illnesses. So, what if you could increase the capacity of your doctor's brain, pack it full of information, and then connect his brain to other doctors? He'd have more knowledge to draw upon when treating you. And wouldn't it be nice if we could access him through a click of a button? The growing field of telehealth can make this happen. It encompasses a variety of things like remote healthcare video conferencing, transmission of still images, patient web portals, remote monitoring of vital signs, continuing education for health practitioners, and nursing call centers. All of these extend the reach of services that a patient or doctor has access to. Dr. Dale Elverson is the medical director for the Center for Telehealth and Cyber Medicine Research at UNM. He says, our country spends much more on healthcare per capita than any other in the world, but we haven't achieved better results. So I believe healthcare needs to be transformed through innovations like telemedicine. The New Mexico Broadband program will be the foundation upon which a statewide telehealth system will be built. Before a remote consultation happens, or a remote database can be queried, or a remote device can be monitored, a cable or tower must exist to relay large amounts of information. Think of the implications of these programs. If you are in an urban city with large hospitals, you usually work with a family practitioner who refers you out to specialists when the need arises. Out in rural New Mexico, these specialists are not available. So people's first thought is not, where's the address of the specialist office? But, am I willing to ask someone to drive me a few hours to Albuquerque for an appointment? What if they reschedule me? Will they want me to stay for more tests? Will they refer me to another doctor? Can I afford a hotel? Where is telehealth currently making an impact? One of New Mexico's most comprehensive and proven telehealth programs is managed by the Sangre de Cristo Community Health Partnership. The Sangre Expert program aims to do screening, brief intervention, and referral to treatment. It has established remote communication infrastructure at several medical and public health sites in the state, which have been utilized by a number of medical and behavioral health programs. It integrates new monitoring and communications technology with new workflow patterns to improve care and reduce costs. As a result of its use, an independent economist calculated a savings of almost $3 million a year. These savings have the potential of impacting state programs in healthcare, law enforcement, and the judicial system.
With telehealth, we have been able to improve access to information to both patients and providers concerning behavioral health services. We have been able to improve manpower development and training for behavioral health social workers in the areas of motivational interviewing and screening and brief intervention. It has also been very useful for the patients. The patients, with a trained social worker sitting next to them, begin to feel comfortable in using the technology with the social worker, almost to the point where they feel that they are in the same office.
Another well-established program is called New Heart, which has a wellness center for cardiac rehabilitation in Albuquerque.
What we really need to do is to grapple with some of these issues in telemedicine and in general, because we're unaware of the tsunami that's going forward. For example, people that are born in the year 2000 will will not live as long as their parents. That's the worry. We as a country do not have the best healthcare system in the world. We have the best disease care system in the world.
So rather than just be reactive to disease, telehealth can cross large distances to be proactive to address symptoms before major events like a heart attack. In addition to their local patients, New Heart has engaged in remote treatment for identical patients in Gallup. Through remote conferencing and remote telemetry devices, rural patients can be prescribed the same physical, dietary, and emotional program. With advances in telehealth, new telepractices are opening up that address rural needs. An example is public schools that need to address speech and language pathology. A company like Unlimited Therapy is applying its services to remote school locations. They have video conference interactions with students to perform screening and engage in speech therapy. In this way, a single physical therapist can serve many schools. Eventually, this will be done on an array of topics. Who will push for telemedicine healthcare reform? The New Mexico Telehealth Alliance aims to support a statewide telemedicine framework. It is made up of doctors and researchers from hospitals and clinics around the state. Rather than supporting single telehealth initiatives that have a limited lifespan, the Alliance is more interested in establishing continuous statewide services. For instance, they propose a new vital care monitoring service. It would cost $3.4 million to create and implement. The return on investment has the potential of being over $24 million in reduced healthcare costs. Once operational, they expect to have 1,000 patients using the system at any given time. Let's see how vital care would work. A vital care monitoring kiosk is placed at a public location in a rural community. Through the Broadband network, they are connected to a central server in Albuquerque. The patient periodically visits a local kiosk and logs in to perform tests. Telemetry data is transferred to the server and entered into the patient's record and compared to doctor-prescribed thresholds. If values are outside of the norm, monitoring nurses are engaged to interact with the patient. Serious conditions are sent to an attending physician for action. A system like this could serve several hundred patients in any given community. In the first year, 50 kiosks would be deployed in rural and tribal population areas. However, the potential of telehealth will not be realized until broadband is accessible. Once this happens, the cost savings will drive clinics to set up infrastructure to support telemedicine. Doctors would learn to practice in a new manner. Insurance providers will adapt their coverage plans. And consumers will use the system, showing a demand for a product enabled through a present-day technology. To learn more about New Mexico telehealth programs or the New Mexico Broadband program, go to these sites. The prospect of expanded broadband access addressing healthcare needs will bring new telehealth opportunities for many New Mexican citizens.